Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. R. Rajalakshmi. R. Rajalakshmi, she is a renowned gynecologist, obstetrician, and the past president of IMA Udupi chapter. She's been educating the children, especially the teenage children and the others, by visiting the schools and the colleges. And apart from that, she has given many TV programs and also the radio talks. And more than that, she has written a beautiful picture, Vatsalya the Osuge, which explains everything that a woman can have problem in her lifetime, right from menarche to the menopause. And today is happens to be the Suraksha or the day for protecting the motherhood. And so she is going to tell us about the motherhood. Because I remember when I was a child, about 70 years back, a young lady, 18 or 20 years old lady, died during her delivery. And when the funeral procession was going, she was papery white. And the girl, who happened to be her friend, she was so scared. She said, "Oh, she has become a bhuta. See how she has become white, and she'll be on the tamarind tree." And all those things are gone now. And after 70 years, where are we? What is the mortality rate before and what is the mortality rate now, and how do you give protection, and what are the government projects that are there for the benefit of the mothers? Please tell us.
Yeah. Thank you, ma'am, for your kind words. Yes, April 11th is observed as Safe Motherhood Day. It started long back in 2000 by White Ribbon Association of India to create awareness about the maternal mortality. Now, if a woman dies from her during her pregnancy or 42 days after her delivery, during those 10 months, it is considered as maternal mortality. As you said, 70 years back, up to even recently 20 years ago, it used to be in 200 to 300 per 1 lakh live births. But we are happy to say that because of the initiatives and the more awareness which is being created, the rate has come down to 97 during the last NFHS. And recently, 2 months ago, one more survey was there. It mentions it as 88 per 1 lakh live birth in our India. And we are happy that in Karnataka, we have already reached the SDG goal given by WHO, which is 70, and Karnataka is 58. So we are happy, but we can't stop here. Okay.
That the
So
credit
why
goes to
should
the
we?
gynecologists and the obstetricians who
Yes,
are very vigilant, and the ASHA workers, we have to thank them.
yes. Yeah, everybody. Safe motherhood means it doesn't depend only on the mother. It is her family, it is the doctor who is taking care, it is all the other health workers along with the government, which is striving to get down this maternal mortality rate. So, if we look at why maternal mortality happens, why do mothers die? First thing is the case you mentioned, postpartum hemorrhage. There is a bleeding after delivery. It can happen if you're anemic, if your age is less, if your age is more, or sometimes without even any reason, any placental causes, she can bleed. Second
Yes.
is sepsis or infection, which
Hmm.
happens because of many other conditions. Third
Okay.
reason, which is coming now, is hypertensive disorders. That is
Yes,
when the
very
blood pressure,
important, very
yeah,
important. I remember one of our classmates, yeah, you never used to sleep. He used to play the cards. And in the morning, he would come and write 120 80, 120 80 to all the patients. And it so happened that one day, a pregnant lady, she started having fits. And
convulsing.
then we realized that the BP was so high, and that fellow was not recording. So this is very, very important for every doctor and every patient to see that their blood pressure is in time,
Yeah.
in a normal range.
Normal level.
Otherwise we lose two lives, mother and the
Yes.
child, both we
And
will
the
lose.
child.
Yes,
Yes.
that was the
And that
lesson
is
that
the
I
aim
learned.
of our
Yes,
that is the aim of our Safe Motherhood Day, to ensure a healthy mother and a healthy child. So fourth cause is teenage pregnancy and unsafe abortions, which are resulting in that. So how do we prevent all this? Like I said, it is a collective approach. So The public also should know what are their health needs to get pregnant with the optimum health of nutrition, optimum age, optimum weight, and take regular antenatal checkups, do all the tests. And they should know which are the danger signals. And whenever they see any danger signal of giddiness, excessive vomiting, tummy pain, or bleeding, they have to report to the doctor immediately.
Yes.
And then some myth busting. They have some beliefs which has come from long time. There is no scientific basis for them. So
Yes.
it is a duty of us doctors to burst those myths. And also there should be family support. Like if
Yes.
she is pregnant, it is her responsibility. She has to look after. That is some mentality in our society. No, she has to be given support. Her husband, her family, and even the society, her workplace support
Yes.
also is needed to maintain this.
Yeah, for the work support, see, when I delivered 46 years back, only 45 days was given, both
Yes,
antenatal, postnatal together. And it used to be so difficult to leave as a nursing mother to leave the baby and go for the duty. But now the
yes,
government has increased it to 6 months.
increased.
And that is a
Yes,
great
6 months.
thing. The government has made such a good effort for helping the nursing mothers.
Yes,
That's a great thing.
six
Yes.
months, and sometimes it can be extended up to 1 year also. And there is
Okay.
some child bringing up leave. I don't remember the exact name. So if there are mothers can avail leave on that basis till the child reaches 12 to 14 years. That is
Oh my
also,
God.
yeah,
Okay.
yeah, yeah, yeah.
Okay.
There is a leave like that, facility like that in government sector. So that is all has been done to maintain the health of mother and
Mother
child.
and the child. Yes.
Child, yes. So this is what has been, and also the mother who is trying to get pregnant, to ensure optimum health, she should have a healthy lifestyle. She should eat healthy, exercise, sleep on time. She should have a calm, peaceful mind. She should avoid all the bad habits of smoking and diabetes, and make
Drinking.
sure you
Yeah.
don't get pregnant too early or too late. And taking a professional consultation whenever there is a need. That is the main thing.
Okay.
Need of the hour. Not going through some influencer or some Google doctor, like you said, because
I
you
know.
always keep telling them about Google doctors. So they give information, but it is not
Yes.
a tailored
That is
information.
not
So
the
that
knowledge. That's not the correct
non,
knowledge. And
yeah,
it may not apply to you. It is in
you, that's
general.
what.
Yeah.
Yeah. Customized treatment and everything will be given by
Only the
your doctor.
doctors can give. Yeah.
Google cannot give you. So that is the message we want to tell them. And make use of all the government facilities. See, even government has so many facilities. First is Janani Suraksha Yojana. During this, in this Yojana, government provides a free facility to all antenatal mother. There should not be any denial like this is there. Even her antenatal care, her delivery, even if ambulance service is needed, everything will be given. Same thing is
Free.
there in Janani and Shishu Suraksha Yojana, where baby is also given care for first month of its life. Then there is a scheme called Matritva Vandana Yojana, where there is
Okay.
some financial benefit to the mother,
Mother
especially if she delivers a
delivers a baby
female
girl.
child, that baby girl, it is there. So there is also a Poshan Abhiyan to improve the
Nutrition.
nutritional status of the mother and child as well as. Then there is PMSMA, that is Pradhana Mantri Swastha Matritva Yojana. It happens every 9th of every month, where private doctors go and give their service, free service at the government hospitals to see the
Great,
high risk
great, great,
pregnancy,
great. Very nice.
high risk pregnancies. And there is extended PMSMA, where it happens on the 24th of every month, where especially we see the high risk pregnancies. And what happens here is we give one Asha worker the responsibility of this patient. She has to
Wow.
see to it that that lady has to be given full antenatal care. Every 15 days, she has to be checked. She has to monitor her BP at home. The Asha
Okay.
worker has to see that this lady delivers in the institution, so that
Yeah.
she doesn't
The
land up
safe
with any,
delivery. Yeah.
yeah, complications. So
Hmm.
there is additional incentives now. There's something called Mission Shakti. So there is
Okay.
incentives additional if it is a girl child. There's all things are there. And government also sees to it that not only to the mother, it also has some schemes for the healthcare workers like ASHA workers, even for the
Okay.
doctors. There is a scheme called Lakshya. Lakshya is
Oh,
teaching the labor room staff and doctors about the emergency protocols. What you have to do if
oh,
there is a PPH, what you have to do
great.
if a patient throws convulsions, what is the emergency kit. So all this is there.
Okay.
Even
So
our
there is so that there is no delay in giving the right treatment,
care.
in saving the baby. So
Yeah.
everything can go like a clock like precision, The
Yes. When you
moment
say
any
code red, they
emergency
should
occurs
know
and
what to do.
immediately you rush. It is the
Yeah.
emergency treatment. Great,
Yeah,
great.
that is
That's
given.
very nice.
Even our association, FOXY, that is the national level obstetric and gynec association, we also train like that. Private doctors also. There's a called Manyata. This is
Okay.
upgrading your skills and updating your knowledge. So even
Wow.
these things go a long way. And the
Hmm.
best thing, ma'am, if you see, all these mothers are given the info IEC,
Hmm.
information, education, the materials, what is given is too good.
Okay.
They are given some
That is
mother and
pamphlets are printed.
it's a book, printed book,
Book.
ma'am. Maternal
Oh,
and
wow.
child card is there, and there is a book
Okay.
called as MCH book or a safe motherhood book. Tai Cardu we say. It has
Okay.
all the details every month what they have to do when they should visit doctor. Not only for the
Hmm.
mother, even for the baby, how it should grow, what it should be, its weight, when it has to be
Wow.
immunized. It's
So
almost a
nice.
10 to
So nice.
15-page booklet which
Ah.
is fully given knowledge to how
Oh,
to
wow.
maintain a healthy mother and healthy child.
Oh,
So these
Thai
are all the
cardo.
things
Thai
we do.
cardo. So nice.
Thai card.
That means the
Yes.
whole knowledge is given in a nutshell. It is
Yes,
so
of
very
course.
nice. Yes.
Yeah,
And
yes.
if they have
And
any
to
doubt, they can always ask the ASHA worker or
yes.
their doctor. Yes.
Yeah, Asha workers are like the grassroots level workers, and our
Workers.
patients believe them more than us. So we train Asha workers more to give the
More
proper
than
knowledge.
that's good.
Okay,
Great,
so if
great.
they see anemia, hemoglobin 10, they pull the patient to the PHC or CHC to give iron sucrose injection. So though that well they are trained, and of course they have some incentives, but because of that they are doing work well, and our
No,
MMR is
but whatever it is,
reduced.
it is a great service. And saving
Yeah.
two lives is not a joke. So
Yes.
timely
Okay.
treatment can save two lives. That's a great thing.
Yes.
Yes.
Okay. And motherhood, safe motherhood also has to be proper postnatal care. They have to be given lactation advices. They have to be given family planning advices so that they don't land up with unwanted pregnancies and unsafe
Again,
abortions. So
within
that
no
is,
time. Yes, yes.
yeah, that is also included in this safe motherhood care. So all
Mhm.
in all, we have to see to it that woman gets an access to antenatal, optimum delivery care, postpartum care, so that mother and child both are maintained healthy. So that is why we
And
observe this day.
thanks to these measures, I remember about 30 years back, a lady had come with the fits. And then when we did the echo, we found that there was a clot inside her heart.
Yeah,
And those
pulmonary
clots were
embolism.
going. That was a peripartum cardiomyopathy. And she happened to be the wife of the pujari who does all the Mata mantra. And see, you may do Mata mantra to others, but you cannot do to your wife when she is already having a peripartum cardiomyopathy. And that's
Cardiomyopathy.
how we know the nutrition is so important. And now that a number of our incidents of peripartum cardiomyopathy has come down,
Come
thanks to
down.
the all these programs where nutrition
Yes,
is taken care and
yes,
everything is
yes.
done. And it is
That's why
really
we insist
remarkable. Yes.
on
Mm. Mm.
we insist on proper antenatal care for that only. Every
Mm.
visit we have to check. We have a checklist. It is called gestosis score. It is based
Okay.
on your age, which pregnancy, whether you had sugar, whether you had BP, all those things, and we have to mark. If the score,
Mm.
if there are some 14 factors to be marked, if the score
Mm.
is above 3, they fall
Mm.
under high risk category, and
High
they
risk.
need extra care.
Okay. One
And this
ASHA worker is there all the time to take care of them. Wow.
yes, yes, all
That's
this.
really
So
nice.
that is how we have. Along with that, we also should appreciate our our obstetricians also. They are also
Mm.
doing very well. They are upgrading their skills. they are being up to date with the knowledge and all the improving the science, everyday changing science. And there has been many methods of controlling postpartum hemorrhage and saving the mother. So they also have to be given their due credit.
Okay.
Yes,
I give full credit to not only the obstetricians and the ASHA workers. I want to give credit to the people. I want them to listen to you and understand the importance of saving the life. And now, when the government is doing so much, why not join the hands? So it is not only the Sarkara, the society has to join. And only when we join two hands, we can do Namaskara or we can clap. So
Clap.
come, let us all take care of our mothers and the children and have a wonderful, safe
Yes, because
maternity.
maternal
Yes.
health is the key indicator of society health. How the society
Yes.
is, how the
Yes.
country is.
Yes.
So it
Yes.
has to be
Yes.
maintained.
Yes.
Yes, ma'am.
That's very nice. Thank you so much, Dr. Lakshmi. Thank you.
Yeah, thank you, ma'am.